going to begin by doing the muscle tests associated with the pronation and supination protocol. First is the muscle test for the medial arch, which is the psoas muscle. I'm going to push down, resist. Good. Then the muscle test associated with the lateral arch is the glute medius. Going to push in, resist. Good. And then for the anterior arch is the quads. Both feet on the table, please. I'm going to push down, resist. Okay. Finding the muscle test to be a grade 4 or less, we'll continue on with pronation protocol. First, the navicular. Subluxates inferior and medial, so you're going to adjust superior and lateral. Cuboid. Uniform.
Well, if you know the way it subluxates, by part of it, you say yeah.
Met heads. Chalice. And calcaneus. And the phalanges.
One indicator for pronation is a positive indicator drop test.
And fibular head. I'm going to do a retest after the pronation protocol. The psoas muscle. I'm going to push down, resist, and find it to be a grade 5. Finding the muscle test to be a grade 4 or lower, I will go on with supination protocol, beginning with navicular and cuneiforms. Cuboid. Met heads. Talus. Calcaneus. Phalanges. And fib head. I'm going to do a retest. For the psoas muscle, which is associated with the medial longitudinal arc. I'm going to push down, resist, and find that to be a grade 5. Go. To assess the hip, I will first do a rectus femoris test, muscle test. I'll have you pull that up and resist when I push down. Okay. If I find that to be a grade 4 or less, there are 2 techniques I can do. The first one would be the posterior glide. And wherever I feel restriction is where I would adjust, or I could do the wrist extension technique, where I would contact the greater trochanter.
Oh, wait. This is the last video.
And do wrist extension. Then I would retest, call that up, and resist, and find that to be a grade 5. Okay. Okay, I'm going to be assessing the knee. Make sure that it's an extension and apply both the vargus and the valgus force. Alright, can I have you roll over, please? Roll over. For the wrist extension technique, if I feel movement lateral to medial, then I will contact the medial condyle.
Yeah.
If there's movement medial to lateral, then I'll contact the lateral condyle. And if there's movement in both, then first I will do the medial condyle.
Oh, yeah.
And then the lateral condyle. If I felt that there was movement medial to lateral, then I would do the prone knee, or lateral to medial, then begin medial. If there's movement medial to lateral, then I'll contact the lateral condyle. And if there's movement in both, then I will do both. Now I will reassess. Can you roll over for me, please? And apply the vargus and valgus force to find that there is no movement. Now for the patella, you will assess movement, and if you feel any restriction, then you will adjust in the force in the direction of restriction. For the bunion, you're just going to do a bunion slip and do that a few times. For the hip, we're first going to do the tensor fasciae lata muscle test. I'm going to push in, resist. Okay, finding that to be a grade 4 or less, then you will assess for internal and external rotation. For internal rotation, you will assess, and if you feel restriction, adjust into restriction. For external rotation, you will adjust into restriction if you feel any that way. After that, you can retest, resist, and that should be a grade 5. Okay, we're going to go through some alternates. The first ones will be for the talus in prone position. You can just adjust the talus into the table, and then for this one you can adjust the talus with a thrust. Can you roll over for me, please? Another talus alternate would be in supine position, just adjusting the talus into the table. The one for the great toe, the C-clamp, that. Then we have the patella. You can assess the patella, assess for any movement. Feel some movement lateral to medial, so you would adjust it in the force of restriction. And the bunion slip, just this side of the bunion, and do that a couple times. Rotation and contractions. And wherever you feel restriction,